Bismillahirrahmanirrahim. Now, this is our first lecture, that is small intestine 1. Its motility secretion will be discussed in this lecture, that is small intestine, lecture number 1. This is actually 7th lecture, I think. So what you are going to study in this, these are the objectives of our today's lecture. We will see what are the different types of motility present, in small intestine, because small intestine contain smooth muscle cells and they will contract and relax and will give you some type of motility. So we will see two different types of motility and what is the effect of these motility. What is the effect? Why it is required? Then we will see how the motility is controlled. What factors controlling the motility? And what is the secretion present, or what is the intestinal juice? Intestinal juice, like gastric juice. There is some fluid present in the intestine. We call it as intestinal. It is an intestinal juice, but it is named as succus entericus. This is nothing but the intestinal juice. Then we will see the enzymes. What are the enzymes present and where they are present and what they will do. And the role of small intestine in digestion of the nutrient. So this is how our lecture will move. For the GIT, all parts, we will discuss 4 headings. Number 1, what is the motility, different types, what is secreted there in that part, which body or which food component is digested, and how the absorption take place. So every place, like the stomach, or maybe when the food is in the mouth also, everywhere we will see what is the movement, what is secretion, what is digestion, and what is absorption. So for intestinal motility, there are 2 types. 2 movements are seen in the intestine, small intestine. One is known as segmentation. And second one is known as migrating motility complex, MMC. The short form is MMC, migrating motility complex. As the name suggests, segmentation means it is dividing the thing into different segments. So intestine, suppose we are considering as a pipe, hollow pipe. This segmentation contraction will make it divided into different segment. Because of this type of contraction, there will be different compartments or segment will come. And this is known as, here it is, just one segment, second segment, third segment, fourth segment, like that. So this is the segmentation. This segmentation causes mixing and slow propelling of the food. It is causing mixing of the food here and also moving the food little bit centimeter by centimeter to the next segment. So this is the action of segmentation movement. Mixing plus propelling the food of this to the next segment. Let us go deep into the segmentation. So these segmentation movements are nothing but the oscillating ring-like contraction. As I shown you here, that the intestine, which is a hollow tube, it will, because of this ring-like contraction occurring here, here, and here, it will be divided into different segments. It will be divided into different segments because of the ring-like contraction taking place at a specific distance, a small distance, because of contraction of the smooth muscle. And these are oscillating. Oscillating means they are not completely remaining like this. They will be there and they will disappear, and it will appear maybe at another place. Maybe it will appear here, maybe it will appear here, maybe it will appear here. So there will be change in the position. They come and they go. They come and they go. This is called as oscillating ring-like contraction which are happening. So by this way, the semi-digested food which is present here in this area, which is known as chyme, which is present here, semi-digested food, we call it as chyme. This will be rolled. It will be rolled in this segment. It will be rolled in this segment, and again in the next few seconds, it will become it will mix with the food from segment number 1 to segment number 2. So this is occurring, these contractions occurring at every few centimeter distance, which will be dividing it into the different segments, and they will cause mixing of the chyme, and it will move the food to the next segment, or chyme to the next segment. To explain this, the diagram is shown here. Suppose, let's say at 0 minute or 0 time, when we are starting to observe, the segments are like this: 1 here, 2 here, 3 here, 4 here, and 5 here. And here is the chyme present, here is the chyme present, here is the chyme present. In maybe after 3 minutes or 5 minutes, it will change. The one which it was contraction here before, now it is relaxed at this segment. The one here, it was relaxed, now it is contracted. So the position is changed. Now contraction becomes relaxation, and this relaxation becomes contraction. Similarly, other. By this way, the food will be mixed. You can see it here. This is brown part, and this is yellow part. They will be mixing here, and there will be mixing. Again, in the next few minutes, let's say after 10 minutes, you will see the one which was contracted here. Now it is relaxed area. Now the relaxed area is contracted area now. So this contraction and relaxation at different segment is taking place. This is allowing the food to mix as, yes. What happened?
There is no slideshow.
No slideshow? This team is making some problem. Let me reshare again.
Okay, doctor.
Okay, 1 minute more. I started before it appears, huh? How many slides you have seen?
Until the objectives.
Oh, only objectives.
Yes. First, I was thinking you just explain.
No. I started here. Yes, salam. So you have seen the objectives. Okay, this is the second part. I don't know in between automatically. If please remind me, huh? When you don't see or the slide did not move, please remind me. So we are able to discuss that the small intestine under 4 headings. Motility, what is the motility in the small intestine? What type of secretion is there? Which food is, or how it is digestion, how digestion takes place, and how absorption take place. In the next slide, I told you that there are 2 types of movement seen in the small intestine. One is known as segmentation contraction. Let me draw with a different color then. So first one was the segmentation. Second one is migrating motility complex. And I told you that if you imagine a small intestine as one hollow pipe, straight pipe, due to segmentation, it is divided into different parts, segment 1, 2, 3. This will make the food to mix here, as well as to propel or move it forward to the next segment. This is called as segmentation contraction. Why it is happening? It is happening because of oscillating ring of contractions are appearing. So if you draw the small intestine like this, so at one place it is contracting here, then here, then here. In the next phase, the same small intestine will look like slightly different. Different regions will be contracted. The area which was contracted before, relaxed before, now it is contracted. And the area which was contracted, it will become relaxed like this. I will show you in the next slide. And every few centimeter, these types of contractions are occurring. This is causing mixing of the food or mixing of the chyme. The semi-solid, undigested, partially digested food is known as chyme. And it will mix the chyme with the intestinal fluid. Also, it will bring them in contact with the mucosa. This here, it will bring them into the contact with the mucosa so that the enzymes will act on it. So this is the slide which I was explaining, that at 0 time, when this is the situation that there is a one segment, second segment, third segment, and fourth segment. For the purpose of understanding, we shown you different color here to show you that this is the food present or chyme present in segment 1, chyme present in segment 2. In the next few minutes, it will become opposite. The contracted area become relaxed and the relaxed area become contracted. And that's why the food will mix. The brown color will mix with yellow color. And in the next few minutes again, the different position will be there. Like here contraction was there, so it becomes relaxed. Here relaxation was there, it will become contracted. By this way, there is a mixing. You can see purely yellow color, now it becomes yellow and brown color. So this is just showing you that how the mixing is occurring because of contraction and relaxation at different segments. Who is responsible for contracting and relaxing the small intestinal muscle? It is initiated by the small intestinal pacemaker cells, same like pacemaker cells present in the cardiac muscle. Here also in intestinal muscle there are some pacemaker cell. What is the property of pacemaker cell? Can anyone tell me? How the pacemaker cells are different from other cells?
They can make action potential.
Initiate action potential.
Initiate the action potential, yes. So normally when resting, there should be a straight line, horizontal line, minus 90 millivolt. But pacemaker cells, they will not have straight line. There will be always fluctuation, going up and coming down. The potential will not remain static. It is always dynamic or changing. Because of this changing potential, you will always see a wave-like pattern. Wave-like pattern. This is known as BER or basic electrical rhythm. BER or basic electrical rhythm. When this BER waves, the upper part, this if it is going up, it is called as depolarization. If you remember from your foundation course, depolarization means it is going towards towards zero. Repolarization means it is coming back to the minus side. Repolarization. If this depolarization wave, if it reaches, suppose this is the threshold, if it reaches here, it will lead to action potential. Like this. Once it reaches here to the threshold line, again there will be action potential. So these action potentials will be converted or they will cause depolarization of the muscle and muscle will contract. So muscle contraction is occurring due to the basic electrical rhythm reaches to the threshold level. Why it will reach to the threshold level? Either it will be due to stretching of the muscle because too much chyme enters here, so it will stretch this muscle here and here. So it will cause the BER to change to action potential. If the action potential occurs, then it will lead to the contraction of the muscle. Or maybe due to some hormone, is acting on these muscles. Some hormone acting on these muscles may cause change in the potential to reach to the threshold level. This will lead to formation of action potential and followed by contraction. So increased segmentation is caused by distension. That means the food which was suppose this is the normal size of the small intestine. Because of the extra chyme, if it is appearing, it will stretch. And this will lead to segmentation. This will lead to segmentation contraction. Or it may be due to gastroileal reflex. When the food is in the stomach, suppose the food is still in the stomach, then the small intestine will show segmentation contraction. Why? Although food did not reach up till now, here there is no food, but food is here. Because the food is here, it will release gastrin. This is a hormone released gastrin. And this gastrin, along with the blood, it will come and act here on the smooth muscle cells of the small intestine to cause contraction, to lead to depolarization and contraction. This is a cause of segmentation contraction. Segmentation contraction movement will be suppressed during sympathetic stimulation. If sympathetic nerves are stimulated, these contraction will be suppressed or segmental activity will be decreased. So we have got three parts of the small intestine, right?
Yes.
What are the three parts?
Duodenum, jejunum,
Mhm.
and ileum.
Yes, duodenum, jejunum, and ileum. So the segmentation starts in the duodenum and then it will travel. So when the food enters here, it will cause contraction and it will cause the segmentation contraction. But sometimes the food is still here, the ileum starts to contract. The cause and the effect is known as gastroileal reflex. Although there is no food, there is no stretching, but still it starts contraction because of gastrin is released from the stomach and come and act on the small intestine, ileum or jejunum. This is causing the contraction to start. This is called as gastroileal reflex. Although there is no food, but still, or food is present in the in the stomach, but ileum starts to show segmentation. As I told you before, segmentation contraction are useful for mixing the food with the digestive juices and also rolling the food so that it will be come in contact with the mucosa so that more absorption and more digestion will start there. And also it will cause moving the food to the next segment or maybe to the large intestine. So propulsion of the food, mixing of the food and exposing this food to the mucosa for absorption. There are different frequencies of contraction in different region. Like in duodenum, it will be 12 contractions per minute, 12 segmentation contraction per minute. When you go to the ileum, terminal ileum, it becomes 9. So here it is faster contraction. Here it is slower contraction. That's why the food will go in this direction from duodenum to ileum. So for the food to pass throughout the small intestine, it takes about 3 to 5 hours. In 3 to 5 hours, the whole journey will be completed. The food will enter into the duodenum and then pass until it reaches to the large intestine, before the large intestine meaning. So it takes 3 to 5 hours for emptying. Second type of contraction which we observe in small intestine is known as migrating motility complex. Migrating motility complex. What they will do? They will sweep the intestine between the two meals. Suppose you have taken breakfast here. Breakfast is at this time. Sorry, breakfast. Suppose there is a breakfast here at 7 in the morning, and maybe at 1 p.m. you have lunch. In between, the ileum is having food. The food which was of breakfast, it will be passing slowly. What this MMC will do, it will clean this area. It will sweep out all, it will take like a broom like this and clean all the small intestine and prepare it for the lunch. The lunch, the another food is coming. That's why it will clean the small intestine. That's why it is known as housekeeping contraction also. Housekeeping. MMC is also known as housekeeping contraction because they will sweep all the material from small intestine to the large intestine. How it look like? It's a weak but repetitive contraction, repetitive and peristaltic. Peristaltic means it is moving. Contractions are moving from one area to another area. That is why it is called as peristaltic contraction. A small repetitive peristaltic waves which will remove the food from small intestine and throw it into the large intestine. This is called as migrating motility complex. It starts in the stomach and migrate down in the intestine. So that's why it is called as the housekeeper contraction. Housekeeper contraction. It is regulated by the hormone known as motilin. So motilin, which is secreted from the endocrine cells of small intestine. It is secreted from small intestine only, and it will be acting on a small intestine only to cause the repetitive contraction, peristaltic contraction, to clean it. This is the action of motilin. To explain this is a very good example that you might have observed, that these are the cleaners. 1, 2, 3 floor cleaners are there, and they are pushing the dirt from one area to another area, a small area. Then one will give it to 2, 2 will give it to 3, 3 will give it to 4, and that's how it is total area will be clean. This is, you might have observed it in the cleaning of the haram. Okay, so from here, the small intestine will open into the large intestine. And this is occurring through a specific area that is called as ileocecal valve. Okay, this is small intestine, and this is cecum. Cecum, and this one is the appendix. Okay. So it is not like one on the surface it is connected, but it will protrude into the cecum and will remain closed unless the food comes. If the food is coming here, it will stretch the wall and it will make it open, and the food will drop into the cecum. If there is no food, it will always remain closed. Why? Because here are the bacteria present. Here in the large intestine, many different types of bacteria are present. They should not enter into the small intestine to avoid infection. So ileocecal valve is there, and there is a ileocecal sphincter is there. So ileocecal valve is a fold of tissues. These are the fold of tissue, 2 folds of tissue which is protruding from the ileum, whereas the smooth muscles around this area, the lower part, is known as the ileocecal sphincter, which is remaining closed all the time except during the meal. When the food is coming, it will open. Pushing of ileal content forward, cecum causes ileocecal valve to open. So this is how opening of the ileocecal valve is there. Also, it is controlled by intrinsic plexus. It is controlled by intrinsic plexus, that is the which is present within the muscle of last part of the small intestine, ileum. Gastrin is a hormone released by the stomach, can cause relaxation of the sphincter. Gastrin causes, because gastrin is released from where? From stomach. Here are the small intestine, and it is opening into the large intestine here. So this area is acted upon by the hormone which is coming from here. So gastrin is released from here, and it will act on the ileocecal sphincter to cause relaxation. Here is the picture shown. This is a fold which is making it like a valve, which will open when the food comes and remain closed. Whereas this area, which is around the last part of the small intestine in the muscle, is causing here. It is causing the sphincter action. Okay, coming to the juice, intestinal secretion or intestinal juice is called as succus entericus. It does not contain any digestive enzyme. If it does not contain any digestive enzyme, then how the digestion will take place? Digestion will take place by the enzyme which are present not in the fluid, but on the brush border of the small intestine. What is mean by brush border? What is meaning of brush border? Yes, if you see, open this intestine, if you go to the dissection room, and you can see that suppose this is a small intestine. If you open it, you will see there are folds here. There are folds which make the largest surface area because of this folding. If you just take a small sample and see under microscope, you will see such pattern. These are called as villi. These are called as villi. If you take a magnification of this villi, you will find that on one villus there are cells, epithelial cells. And on these epithelial cells, you will see fibers. These are called microvilli. So microvilli are present on the here on the epithelial cells, and they are making the brush border. They are making the brush border. Why it is so folded? What is the purpose of this folding? First there are folds, then there are villi, then there are microvilli. Why? Why not a straight line? And these are the epithelial cells. Why not?
To increase the surface.
Yes, to increase the surface area. More surface area, if you count from here to here and to here, it will become many square meters. So surface area will be increased due to different folds, villi, microvilli, and the folds. All these are increasing the surface area so that it will come in contact with the food with a larger surface area, and the enzymes are present here in this brush border. So this is causing the digestion. Basically, what it contains water. Succus entericus or intestinal juice contain water, mucus, and mineral salts. Water is a liquid medium for any solution, and mucus is the one which is causing or preventing the damage of the mucosa, preventing the damage while the food is passing. The mucus will make it slippery so that it will be easily passed. And there are some mineral salts. So there are no enzymes as such in the fluid. pH is around 7.8, which is alkaline. Alkaline pH is there. Around 1.5 liters per day, the intestinal juice will be produced. 1.5 liters, and then it will be absorbed. The secretion increases after the meal due to local stimulation and presence of the chyme in the small intestine. So where are the enzymes present? Enzymes are present on the brush border. Suppose this is one epithelial cells and these are the microvilli or brush border. The enzymes are located here. Which enzymes are located here? The enzymes for digestion of protein and carbohydrate only. It will have enzymes for digestion of protein and carbohydrate only. So how the fat will be digested then? How the fat will be digested? Fat is digested because in the intestinal juice, you will have running here bile salts. They are in the juice, whereas enzymes are present on the brush border. Bile salts are causing the degradation of fat or absorption of the fat, you can say. So protein is breakdown into peptides and later on to amino acids by trypsin and chymotrypsin. Carbohydrate will be changed to disaccharide or some of the monosaccharide. So when the food enters into the small intestine, the carbohydrate and protein will be digested and digest. Okay. Here I will show you now. In the lumen surface of the small intestine, the epithelial cells contain microvilli, which are the projections from making it brush border. And then the enzymes which are present on the brush border are enterokinase, the enzymes which is activating the proteolytic enzyme trypsinogen. The one which will activate the trypsinogen is present in the brush border. Second enzyme which is present in the brush border is a disaccharidases. Di means two. Disaccharidases like maltase, like sucrase, like lactase, which is helping in complete digestion of maltose, sucrose, and lactose. Whereas amino acid digestion will be with the help of aminopeptidases. Protein digestion is with the help of aminopeptidases, which will hydrolyze or break down the peptide bond into and make it amino acids, thereby completing the protein digestion. Carbohydrate and protein digestion is completed on the brush border, whereas fat will be digested by bile salts within the intestinal lumen. It is causing emulsification basically. Okay, so the clinical condition related to this chapter is lactose intolerance. What is lactose intolerance? When the person is having lactase enzyme deficiency. Lactase enzyme deficiency. This will lead to what? What will happen if lactase enzyme is absent? Anyone can answer.
The patient cannot digest milk.
Whole
Yeah,
milk or only the lactose?
Lactose.
Yes, only the lactose cannot be digested. Rest other things will be digested. So what will happen if lactose is not digested? Suppose this is a small intestine and it is going to the large, ending and becoming, pouring its content into the large intestine. Suppose lactose is not digested and it will come here in the large intestine. What will happen?
Abdominal cramps.
Abdominal? Yeah.
Cramps.
Cramps, abdominal cramps. Why? Why cramps will happen?
Will have lactose intolerance.
Yes, he cannot tolerate the lactose. That's why. What will happen and why it will happen?
Doctor, the bacteria will
lactose.
ingest the lactose and then it will ferment it. So gases will be released,
Okay, so
which will cause bloating and
yes,
other stuff.
good, very good. Who was this? Who
Noor.
did? Noor, you are absolutely correct. When undigested lactose enter into the large intestine, it will be acted upon by the bacteria, and they will try to digest it, and they will make gases, CO2, methane, and the large intestine, which was like this, it will bloat for having bigger size. This will cause cramps and pain also. Second thing, the lactase, if undigested, enter into the large intestine. It is just like a osmol. It is just like osmol. It will increase the osmolarity, and that's why water will be remaining here. So large amount of water will be remaining. So large amount of will be defecated. It may cause diarrhea also. Diarrhea can also occur, either abdominal pain, cramps, or diarrhea, because there is no enzyme for digestion of the lactose. So how will you treat if suppose the person comes to you? It is observed in newborns, initially newborn, and but maybe another person can also have, but in newborn it is very common. Baby is fed with milk, and baby will cry, severe cry after drinking the milk or after feeding. Why? Because the lactase is not digested, and that's why it will be lactose is not digested, and it will create methane and also causing diarrhea as well as pain. That's why the baby will be crying. So how will you treat?
Give him
Give
milk with
lactose-free milk.
Lactose-free milk.
Very good. Where you will find lactose-free milk?
It's synthetic.
It's present in the market.
Yes.
It is produced. They remove in the factories lactose they removed, and they will produce the lactose-free milk, and it can be available. But you have to observe. The person should see the box is that it is written as lactose-free milk. Here it should be written lactose-free. Then, okay, lactose-free milk is not available. Suppose, what will happen then? What you will advise?
Give lactase.
Yes, give tablet lactase, any formulation containing lactase enzyme. You have to prescribe lactase so that there will be digestion of lactose. Good. So for these clinical conditions, you must read all this through emboss. Go and read all conditions related to applied aspect through emboss, lactose intolerance or another diseases. Okay. So in the small intestine, absorption of carbohydrate, fat, and protein will be taking place. Vitamins and waters are absorbed indiscriminately. What is the meaning of indiscriminately?
Randomly.
No, if you take 1 glass of sugary syrup, 1 glass will be absorbed. Okay. If you increase to 2 glass of sugary syrup, 2 glasses will be absorbed. This is called as indiscriminately. Then read the second line. Absorption of calcium and iron is adjusted according to the body need. That means if the body is having good concentration of calcium, then even though you give big amount of calcium, still only little amount of calcium is absorbed. If you have sufficient quantity of calcium in your body, if the person is eating lot of calcium, still the body will absorb little amount of calcium. Opposite condition, if suppose the person is having deficiency of calcium, very little amount of calcium is there. So if you give them calcium supplementation, he can absorb large amount of calcium. So it depends upon the body's need. Whereas opposite to that, indiscriminately absorption means whatever may be the condition of the body, if you feed with large quantity of that fluid, large quantity will be absorbed. If you take less quantity of that food, less quantity will be absorbed. This is the meaning. So calcium and iron is regulated according to the body's need. Most of the absorption is taking place only in the earlier part, that is duodenum and jejunum. So what the ileum is doing then? What is the role of ileum then? They say ileum or maybe half of the small intestine is just like a reserve. In case of emergency, only it will be used, whereas the remaining half will be actually functioning. So what is the role of ileum then?
Absorb
Or,
vitamin B12.
yes. So the last part of this small intestine will be absorbing vitamin B12 and bile salts. 95% of the bile salts will be absorbed. Only 5% will go in feces. So if last part of the small intestine is resected or removed, then the person will suffer from vitamin B12 deficiency or indigestion of the fat. Indigestion of the fat will occur. So this was our first lecture. Any question on this?
No, doctor, thank you.
No, doctor.
Welcome. Stay tuned and I will start the second lecture.